It's Dr. Steve, master of the subconscious mind, and doctor who fixes 100% of orthopedic issues not related to cancer, fracture, infection. And let's fix hypertension today. The people who are suffering from blood pressure and you can't figure out why, and you're stuck on a medication and you're like, it's just genetic. Because just because you have the genes for it doesn't mean that is your destiny. Your emotions and environment influence the DNA. It changes the epigenetic expression. So in that, we have to understand what causes hypertension, and we have to look at the hormones and some of the other factors going on with it. So when we look at it, we look at aldosterone. Aldosterone controls sodium and potassium regulation, right? And so with sodium and potassium regulation, when that becomes out of balance, now angiotensin 1 and angiotensin 2, which are blood pressure regulators, become problematic, right? So in that, when we don't address the problem, what happens is angiotensin 1 and angiotensin 2 are dysregulated, so we end up having strokes, heart attacks, or atherosclerosis. These are all buildup of fatty acid oxidation blocking or clogging up the cell. And so, what it is it's causing a lot of this in people is the inability to process these 16 carbon fatty chain acids, palmic acid and linoleic acid. PUFAs, polyunsaturated fatty acids, they don't have hydrogen atoms all the way through the bond. They're 16-chain carbon, missing hydrogen bonds, so they're very unstable and they oxidize very easily. They create unbound iron in our tissue, create the hydroxyl radical formation, crash adrenal, slowing the thyroid, not allowing your glucose to convert to pyruvate, causing blood sugar dysregulation, but also causing peroxynitrate, which is a free radical that causes gut damage and heart disease. Right, so we have these factors that happen in that transsulfurization pathway that are all leading to this oxidative stress, causing blood pressure to go up because it constricts the blood vessels, thinking your body's under stress, which it is because you're eating something that's toxic. And what contains linoleic acid and palmic acid? Seed oils and chicken. So seed and nuts, a lot of nuts do as well. So we want to reduce our intake of those items, right? Canola oil, safflower, sunflower oil, soybean oil, right? All the things that are processed foods, they got to go. We don't want to keep those things in our diet. And if you're struggling from kidney disorders, my God, the renin is actually affected through that, and the renal tubules in your kidneys are impacted. So you have kidney problems, might be these polyunsaturated fatty acids and the high blood pressure that was undiagnosed for a very long time that caused that stress. So what do we do now that we know how to cut out seed oils? Because that's only part of it, because there's also epigenetic expressions to the CYP gene, which are somatic expressions. And CYP genes, if they're expressed, now all of a sudden we get this whole host of oxidative stress going on. So what do we do about these CYP genes? Well, those genes are specifically related to the adrenal glands, and those glands then are going to be in the form of abandonment, insecurity, and vulnerability. So where are you showing up in life and not allowing yourself to be vulnerable? Are you confident in who you are? Are you afraid? Do you act differently in public than you do at home? Do you have to make other people feel a certain way for you? How do you feel if people don't accept you? Right? All these different factors are going on with that. If your partner leaves you, how do you feel? There's 8 billion people out there, right? What's meant for you will find you without absolute doubt, and that's what the universe is teaching you through all these painful experiences. They're gifts in strange wrapping paper. So just because you have the gene for it doesn't mean it has to be expressed. Just find the abandonment issues that you have and the self-worth issues, and then all of a sudden miracles happen. You manifest in this partner of your dreams. You manifest in this unbelievable health. The people that are going to help you get to that path too. So all those things are happening when we address that CYP gene, those belief systems that are affecting those adrenals, which is the aldosterone that's causing the high blood pressure. That blood pressure is telling you to open your heart. That's what it's doing. So now, what do we do besides clearing out these emotions and dealing with this gene, the CYP gene that I talked about? What can we do nutritionally? And I get it's easier than doing some of the work that's repressed and internalized on the subconscious level, but vitamin E, it is an antioxidant that's neuroprotective and cardiovascular protective that protects you against the oxidations, lipolysis, the oxidation of fatty acids. So you need some excess vitamin E in there. We get those from our fat-soluble vitamins. It's great that they're already there naturally for us, but we need to get those in our diets. That's why it's great to cook with butter. That's why it's great to cook with ghee. That's why it's great to cook with What else am I missing? Coconut oil is not good. It's missing fats. You can cook with beef fat, rendered beef fat. So those are all factors that you can cook with. Those are great things. But remember, we want to keep our fast to 25 to 30% of our total caloric intake, or you're going to still have a problem because the palmic acid is still in those foods, right? And so we can't go too high with them. We got to keep this in check. And so we want to add the vitamin E because it's PUFA protective, right? Cardiovascular protective. And then we want to add aspirin. Aspirin is fantastic. Aspirin lowers the oxidative damage from polyunsaturated fatty acids. It actually helps detox the polyunsaturated fatty acids, and what it's going to do is it's going to increase your testosterone, lower estrogen, lower your cortisol, right? It's going to lower histamine, right? Probably lower glutamate as well. So all these inflammatory things are fantastic.